Hi, my name is Allison and I am a counselor over here at Quest Counseling. And today I am going to be presenting on fetal alcohol spectrum disorders. Fetal alcohol spectrum disorders, also known as FASDs, is a term used to describe the range of effects that can occur in a person whose mother used alcohol while pregnant. Physical, mental, behavioral, and learning disabilities may be present in an individual. FASDs are 100% preventable during pregnancy. And with that being said, effects of FASDs are lifelong. A mother does not drink during pregnancy to harm their unborn child on purpose. And there's also many resources in our community to assist you in abstaining from alcohol use while pregnant, and that information will be covered on a later slide. Fetal alcohol syndrome, also known as FAS, tends to have many physical features associated with the diagnosis. Some of the more common ones end up being that low nasal bridge, a thin upper lip, a flat mid-face and shorter nose, and smaller eye openings. To show you, this drawing over here on the left has almost all of the physical features that can be associated with FAS. And then the baby over here on the right, as you can see, has 3 of those features, which, because not every baby is born with every single one of those features, it's typically a combination of a few. To go over terminology, fetal alcohol syndrome is a diagnosis used to describe birth defects caused by alcohol use while pregnant. Fetal alcohol effects, or FAEs, are patterns of cognitive difficulties and growth deficiencies, but there typically aren't facial features as seen in an FAS diagnosis. Alcohol-related birth defects are the physical abnormalities only, which you saw on that previous slide. And then there's alcohol-related neurodevelopmental disorder, and those are complex patterns of behavior or cognitive abnormalities that cannot solely be explained by family factors or environment. And then we have partial FAS, which shows some of those facial features of FAS along with evidence from all of those above diagnoses. The main causes of FASDs are women drinking alcoholic beverages during pregnancy. So all alcohol is harmful and there is no safe amount. Doctors have said in the past that it's okay to have a glass of wine here or there, maybe a sip of a cocktail. And with all of that being said, regardless of how much alcohol you're drinking, any drop of alcohol can be potentially harmful to your unborn fetus. Binge drinking, which is 4 or more drinks in a 2-hour span, is the most harmful to our unborn babies. In 1996, the report to Congress announced that of all substances of abuse, including cocaine, heroin, and marijuana, alcohol produces by far the most serious neurobehavioral effects in the fetus. Alcohol use during pregnancy can lead to lifelong effects, and up to 1 in every 20 U.S. school children may have an FASD. People with FASDs can experience a mix of the following problems: physical issues, which might include a low birth weight and growth, problems with essential organs such as our heart and our kidneys, and damage to parts of our brain. That can lead to the behavioral and intellectual disabilities, which can include learning disabilities and an overall low IQ, hyperactivity, difficulty with attention, poor ability to communicate in social situations, and poor reasoning and judgment skills. This can then lead to the lifelong issues with school and social skills, living independently, mental health, substance use, keeping a job, and getting into trouble with the law. In 2010, drinking while pregnant cost the United States $5.5 billion. To go over the treatment of FASDs, FASDs last a lifetime and there's no cure, but research shows us that early intervention into treatment can improve an overall development for a child. There are many types of treatment options, including medication to help with some of the symptoms, behavioral and educational therapy, parent training, and other alternative approaches. No one treatment is right for every single child, and good treatment plans will include close monitoring, follow-ups, and changes as needed along the way. Treatment should be pretty individualized to meet the needs of the baby and of the family. There's also protective factors that can help reduce the effects of FASDs and help people with these conditions reach their fullest potential. Some of these protective factors include diagnosis before age 6, that baby growing up in a loving, nurturing, and stable home environment, especially during school years, the absence of any sort of violence, whether that be physical violence, emotional violence, or sexual violence, and having that child involved in special education and social services. 1 in every 10 women report consuming alcohol at least one time in the past 30 days in their pregnancy, according to the CDC. 1/3 of women who drink during pregnancy are classified as binge drinkers, which, as I said earlier, would be consuming 4 drinks within a 2-hour span. And among pregnant women, alcohol use tends to be the highest in those aged 35 to 44 years of age. As you can see, 18.6% of women who use alcohol within that range. The second behind them are those college graduates at 13%, and then unmarried women at 12.9%. Resources in our community include a broad range of options from outpatient counseling all the way to residential treatment. And residential treatment is where you are going to go to the facility, live there, and attend multiple group and individual counseling sessions, as well as self-help meetings daily. Intensive outpatient typically involves 9 weeks or 9 hours a week of treatment. And then outpatient treatment can be anywhere from 1 hour to 5 hours a week of treatment, depending on your needs at that time. And then to end the presentation with a quote, "Everything grows rounder and wider and weirder, and I sit here in the middle of it all and wonder who in the world you will turn out to be." And that concludes our presentation on fetal alcohol spectrum disorders. Once again, my name's Allison, and if you have any questions, I'm over at Quest Counseling, and our phone number here is 775-786-6880. Have a good day. Thanks.